Typically, when we shine our blue light on the brackets and we cure the glue that makes the bracket stick to the tooth, about 90% of that glue is fully cured by the time you walk out of our office. However, there's a 10% that will continue to cure over the next 24 hours. The reason that is important to understand is that we ask all of our patients the first couple of days to eat soft foods. And that is really important because our job as orthodontists, when we put the braces on your teeth, is we put them exactly on the teeth where we need them. So when you close together and bite together, your teeth may contact some of those brackets, and that's okay. I want patients to know where that point of contact is and kind of stop at that point. I don't ever want patients to squeeze real hard trying to force their teeth together because that will cause brackets to come off. And as teeth level and align, we call it in our early stage of treatment, those interferences often go away, and as you progress through treatment, breaking a bracket becomes less and less of a problem. However, if you do eat hard stuff, and we talk to you about nuts, ice, candy, gum, chewy stuff, those are things that you definitely want to avoid. I tell patients really the key to keeping brackets on your teeth and not breaking them off is really thinking about the consistency of the food, thinking about what kind of food you're eating, and think, how am I going to eat that food? And oftentimes if you take small bites and kind of bounce carefully on your food, then you won't ever have a problem at all. And we have many cases that we treat that never break a bracket off. But we have other cases that break a lot off. And really, you just have to be very careful. You can't cram a lot of food into your mouth and chomp, chomp, chomp. And I tell people that the biggest thing, people think that our mouth works straight up and down, but our lower jaw as we eat kind of moves in a little circle. And that's how sometimes you can not mean to break off brackets, but it's very easily done. And I tell people the further back you go in the mouth, because our mouth is a wedge like this, the further back you go in that wedge, the less force it takes to exert a lot of pressure on things. If you think about how we eat, if we bite into something with our front teeth, we have to bite pretty hard. But if we chew on our back teeth, you can put very little pressure back there, but it's a lot of pressure if you measure the force and chew very easily back there in the back. That's why we do most of our chewing in the back of the mouth. So the important thing that I tell patients about breakage, we often talk about the length of treatment. And I tell patients, in order to meet our goals and to finish on time, the braces have to stay on the teeth. I tell patients every time a bracket comes off, often it will mean we take 1 step forward and 2 steps back. So very important to keep them in track, and that way we stay on track.